Safety of antiseptics, chemical risk assessment. Safety of antiseptics, chemical risk assessment. Antiseptics have long played a crucial role in maintaining public health by preventing and controlling the spread of infections. These chemical agents are used to disinfect living tissues, surfaces, and even medical instruments, reducing the risk of bacterial, viral, and fungal contamination. However, with the increasing use of antiseptics, questions about their safety have come to the forefront. To address these concerns, rigorous chemical risk assessments are essential to ensure the safe and effective use of antiseptics in various settings. Understanding antiseptics and their importance. Antiseptics are chemical substances that inhibit the growth and development of microorganisms on living tissues and surfaces. They are distinct from antibiotics, which are used to target and eliminate specific disease-causing microorganisms within the body. Antiseptics are widely used in medical settings, ranging from surgical procedures to wound care, and are also prevalent in everyday products such as hand sanitizers, mouthwashes, and cleaning agents. The importance of antiseptics cannot be understated, as they have played a significant role in reducing the incidence of infections and improving overall public health. However, their use raises concerns about potential adverse effects on human health and the environment. Chemical risk assessment. Chemical risk assessment is a systematic process that evaluates the potential hazards and risks associated with the use of a particular chemical substance. In the context of antiseptics, a comprehensive risk assessment involves multiple steps to identify potential hazards, assess exposure levels, and determine the associated risks. 1. Hazard identification. The first step in risk assessment is identifying the potential hazards of a chemical. This involves understanding the chemical composition of the antiseptic, its mode of action, and any known toxicological data. For instance, some antiseptics might be associated with skin irritation or allergic reactions, while others could have more severe health impacts if ingested or absorbed in large quantities. 2. Exposure assessment. This step involves evaluating how individuals might come into contact with the antiseptic and estimating the level of exposure. It takes into account factors such as frequency of use, duration of exposure, and the type of application. For example, healthcare professionals who use antiseptics regularly in clinical settings may have higher exposure levels compared to the general population. 3. Risk characterization. Once hazards and exposure levels are understood, the next step is to characterize the level of risk. This involves considering factors such as the severity of potential adverse effects and the likelihood of exposure. The goal is to determine whether the potential benefits of using the antiseptic outweigh the associated risks. 4. Risk management. Based on the risk characterization, appropriate risk management strategies are developed to minimize or mitigate potential risks. This might include recommending safe usage guidelines, providing protective equipment, or suggesting alternative antiseptic options with lower risks. 5. Communication. Transparent communication of the risks associated with antiseptics is essential for informed decision-making by healthcare professionals, patients, and the general public. This communication should be based on scientific evidence and clearly outline the benefits, potential hazards, and precautions associated with antiseptic use. Factors influencing antiseptic safety. Several factors contribute to the safety profile of antiseptics. 1. Chemical composition. The specific chemicals within an antiseptic determine its mode of action and potential toxicity. Some chemicals might be more prone to causing skin irritation or allergic reactions, while others could have systemic effects if absorbed into the body. 2. Application method. The way an antiseptic is applied can influence its safety. For example, Antiseptics intended for external use on intact skin might have a different safety profile than those intended for use on mucous membranes or open wounds. 3. Concentration. The concentration of the active ingredient in an antiseptic can significantly impact its safety. Higher concentrations might be more effective at killing microorganisms but could also increase the risk of adverse effects. 4. Frequency and duration of use. The frequency and duration of antiseptic use play a role in determining the overall exposure level. Prolonged or frequent use can increase the risk of skin irritation or other adverse effects. 5. Individual sensitivity. People vary in their sensitivity to chemicals. Some individuals might experience adverse effects at lower exposure levels, while others may be more tolerant. This is a significant concern for both human health and environmental health. Conclusion. The safety of antiseptics is a topic of paramount importance, given their widespread use in healthcare and everyday settings. While antiseptics play a critical role in preventing infections, it is crucial to conduct thorough chemical risk assessments to ensure their safe and effective use. These assessments involve identifying hazards, evaluating exposure levels, characterizing risks, and implementing appropriate risk management strategies. Transparent communication of antiseptic risks is vital to enable informed decision-making by healthcare professionals, patients, and consumers. Emerging trends in antiseptic safety. In recent years, there have been notable advancements in the field of antiseptic safety assessment. These developments reflect a growing understanding of the complexities involved in evaluating the potential risks and benefits of these chemical agents. 1. Alternative antiseptic formulations. Researchers and manufacturers are exploring alternative antiseptic formulations that aim to enhance efficacy while minimizing potential risks. This includes the development of antiseptics with improved targeting mechanisms, allowing them to specifically target harmful microorganisms while sparing beneficial ones. Such advancements could help reduce the risk of antimicrobial resistance and unwanted side effects. 2. Microbiome considerations. The human body is host to a diverse array of microorganisms, collectively known as the microbiome, which play a crucial role in maintaining health. Antiseptics have the potential to disrupt this delicate balance of microorganisms, leading to unintended consequences. Researchers are now investigating ways to develop antiseptics that have a narrower spectrum of activity, preserving the microbiome's integrity while still effectively fighting harmful pathogens. 3. Eco-friendly antiseptics. Environmental concerns have prompted a search for antiseptics that are not only safe for human use but also environmentally friendly. Traditional antiseptics can find their way into wastewater systems, potentially affecting aquatic life and ecosystems.